Have you ever felt the tenseness of being alone in a room? Or when you're alone in a room and you hear a random noise and you're scared of what that noise may be? We all experience that fear at one point, the fear of being alone. Whether it be the fear of robbers or intruders coming to our house without us knowing, or it just be the plain awkwardness of silence in the room. This phobia called autophobia cranks this fear of being alone quite a bit. According to medical author William Shield Jr., MD, autophobia is the abnormal and persistent fear of being alone or fearing loneliness. This phobia shows many signs and symptoms that can be treated as well as diagnosed through multiple psychological evaluation. This phobia is a unique phobia that shows many signs and behaviors. As stated earlier, according to Shield Jr. MD, autophobia is the abnormal and irrational fear of being alone or fearing loneliness. This phobia also has another sense, the fear of oneself. People with autophobia are unable to function normally until they are no longer alone, according to an article named Autophobia. According to Erica Serino, people with autophobia exhibit many different fears, such as fear of strangers or intruders, being unloved or unwanted, as well as sudden noises that may happen when they're alone. According to Amy Smith, people with autophobia go through great lengths in order to avoid being alone, whether it be avoiding situations where it's normal to be alone, seeking company as soon as possible when they're alone, and not wanting people to leave their side in fear of being alone. And because of this, they have a lack of independence in relationships. Along with the many behaviors and signs, there are also numerous symptoms associated with autophobia. These numerous symptoms can be split up into two separate categories: physical symptoms and mental symptoms. According to Erica Serino, some of the physical symptoms include shaking when they're alone, sweating, dizziness, as well as chest pain. For the mental symptoms, according to the article Autophobia, people with autophobia obsessively worry about the thought of being alone or what can happen when they're alone. According to Erica Serino, some of the other symptoms include feeling detached from one's own body, overwhelming terror, as well as possibly having a panic attack. With these signs also come chances of diagnosis from a doctor. In order to be diagnosed, um, according to Amy Smith, you have to visit a doctor or mental health professional, as well as your symptoms have to have lasted 6 months before the diagnosis, as well as your symptoms have to be troublesome enough in your daily life in order to be diagnosed. In the healthcare visit, according to Erica Serino, psychological evaluation will be conducted in order to see if there's any issues with your mental health. This will also include numerous questionings about your daily activities as well as feelings. They'll Medical professionals will also take a look at your medical records to see if there's any physical problems with you. After diagnosis comes treatment in order for you to return back to your normal life. Some of the possible treatments include exposure therapy, CBT or cerebral behavior therapy, use of medication, and even the use of support groups. The first one I'm going to cover is exposure therapy. This helps the person face their phobia head on by making them experience their fears in real life, whether it be standing a few yards away from their therapist's office until they can be alone in normal circumstances. According to Erica Serino, this type of therapy exposes the person to the source of their phobia. The other one is CBT. It's similar to exposure therapy where it will help the person experience their phobia head on. It will teach the person to cope with their phobia effectively, as well as find patterns that cause their fear. Medication will also be used if treatment's not enough. Um, Medication will be used with other treatment methods according to Amy Smith. There are two kinds of medications. According to Amy Smith, one of the medications is beta blockers. Beta blockers help decrease the amount of adrenaline that goes into a person's brain when they are alone, thus reducing the fear. According to Erica Serino, the other type is ben- benzodiazepine sedatives, or shortened to benzos, which helps the person relax. However, often or these medications sometimes lead to addiction, which is why medical professionals tend to avoid these methods at all costs. Another source of therapy is support groups. According to the article titled Autophobia, support groups help people share their struggles with similar people and help them notice that they're not alone in their problems. So let's recap. Since I covered a lot of stuff in this presentation, I covered the numerous symptoms and behaviors that come with autophobia, as well as the symptoms such as shaking, dizziness, and chest pain. I also went over the diagnosis as well as multiple treatment plans. I feel this issue is important because a lot of us can relate to the fear of being alone at one point, whether it be that people left the party and you're all alone and you have this feeling of awkwardness, or some other circumstances where you're alone. Next time you're alone, make sure to think that maybe it can be autophobia or not.